All right. Thank you for joining the Ohio Restaurant Association for a quick conversation designed to help restaurants, bars, catering, and banquet services better understand the new Ohio Public Health Advisory Alert System, what the alerts mean to your facilities and services, how we can all help to curb the spread of COVID-19, and suggestions on working with local health departments to mitigate that spread, and what to do if someone in your establishment tests positive for COVID-19. Ohio's restaurants, food service, and bar locations take seriously the commitment to health and safety. As a community of businesses focused on creating great experiences, we understand just how important it is to follow local and state regulatory rules to keep our employees and guests safe. The vast majority of Ohio restaurants and bars have met or exceeded all that is required of them to responsibly restart their businesses for indoor and outdoor dining. We are taking steps to provide further clarification to our industry and to educate Ohioans on what guests should expect when they visit our establishments. The Restaurant Advisory Group that the governor put together under the Responsible Restart Ohio Restaurants and Bars Plan worked hard with state leaders to craft policies that would be workable for businesses diverse in scale and services. I'm Laura Morrison, Managing Director of Membership and Employer Food Safety with the Ohio Restaurant Association. With me today is Garrett Giozzi, Division Manager with Franklin County Health Department and past President of the Ohio Environmental Health Association. Thank you for your leadership in participating with the Governor's Restaurant Advisory Group, Garrett, and for taking time to cover some important topics for Ohio's restaurant industry today.
Great, thanks for having me, Laura.
Absolutely. So, Garrett, we're just going to go through, and it's kind of that rapid fire way of having a conversation, just to talk about, an overview of some of the signs and symptoms of COVID, what happens if a staff member or employee tests positive, and, exhibits those signs of COVID. And then talking about that new alert system that we have and what it really means to be under an alert. And whether we should be concerned about other staff members getting ill, and what are ways to help reduce the spread of COVID-19. And finally, you'll probably have some great suggestions on working with local health departments. So let's get started.
Great.
So would you just give us an overview of the signs and symptoms of COVID?
Sure. So the most common signs of COVID-19 are fever, chills, cough, fatigue, muscle aches, sore throat, nausea or vomiting, and diarrhea. So commonly, those are the most common symptoms. There are some others as well, conjunctivitis, loss of your sense of taste and smell. We've seen that as well.
That's a lot. That's a big list, isn't it?
It certainly is. There are a lot of things going on for sure.
Yep. So what happens in a restaurant, in a food service facility if a staff member or employee tests positive or exhibits the signs of COVID-19?
So the first thing is, if an employee is working and they begin to exhibit these symptoms, they should be immediately sent home. So we should not keep any ill employees on site, running the risk of exposure to our guests and our other workers. So send them home if they have any of those signs and symptoms. Additionally, for someone who tests positive, they need to be sent home and isolated for at least 10 days, and they need to be symptom-free for 72 hours before they are allowed to come back for work. So generally speaking, once an employee tests positive, that information is provided to the local health department, and then that local health department will reach out to that employee or individual and go through a thorough case investigation with them, sort of asking them where they were, were they around someone else who was tested positive or sick? And we'll work through a whole investigation process to identify people who may also be at risk for developing COVID-19.
So is the 10 days isolation, is that something that is true across the state, or, is it something that is a regional?
So that's the CDC guidance. It's 10 days and 72 hours of being symptom free from COVID. That's after your fever without taking any sort of fever reducing medications. So, that's the standard guidelines we're operating off of.
Great. Okay. So should a restaurant, does it mean that they need to shut their restaurant down?
So the restaurant really needs to work hand in hand with their local health department. So there are a lot of factors to consider on whether or not a restaurant should close or what they should do. But they should work out, reach out to their local health departments. It really depends on the scope of the situation. Are we dealing with one employee? Are we dealing with a small outbreak within the facility? And then what those duties were. So was it a host? Was it a server, a dishwasher, a cook, a manager? So we really take into account the totality of the situation based on the guidance we provide. So reaching out to your local health departments, providing them with that information will be able to help you sort of make that decision for yourself as an operator.
So pretty much the first call after you've taken care of the situation is to your local health department. And, that's really about, partnering with your local health department and your own sanitarian who does your inspections, right?
Yes. So your sanitarian who performs your inspections should be the gateway to your health department. They then, would refer you to the appropriate people who conduct those investigations, who are managing the COVID response. So definitely a first step is to call them, and they can get you in touch with the proper people at the health department to start that conversation of what are the risks that are going on if we have a positive employee.
Okay. Well, that actually sounds great because, having that partnership with your local sanitarian is the way to operate your business safely, regardless, not just in this situation, but always.
Absolutely.
So good. So recently there's been a new health advisory, kind of an alert system. It's called the Ohio Public Health Advisory Alert System. What is it?
So it is a sort of a 4-level approach at providing some data and transparency to counties across the state. So there are 4 levels, yellow, orange, red, and purple. And each one of them represents a degree of sort of where the county is in relation to coronavirus spread. So level 1 is the lowest, that's yellow. That basically means there's just active exposure and spread throughout the county. And then level 4 is purple, and that means that there's severe exposure and spread. And we're really saying that if a county is level 4, people should only leave their homes for essential supplies and services. So each one of the 4 orders, basically requests that everyone follow the public health orders that are current at the time. But it indicates really the spread of coronavirus within their community. So the governor's office in conjunction with the Association of Ohio Health Commissioners, the Department of Administrative Services, have really put together this system based on 7 criteria. And each criteria is given sort of a weight within the system to determine the level that counties correspond to. So it's new. It's new for everyone. It's new for the state. It's new for us in local public health. So definitely more to come on what this means, but it allows us to really kind of indicate the spread and the prevalence of coronavirus within our local communities at the county level based on that 7 guideline criteria that the governor's office has kind of laid out for us.
Okay. And I think that it's available on the governor's website, on the coronavirus.ohio.gov website. And so, we'd point people there to look at that. And we most certainly, Ohio Restaurant Association has it on our website as well, and probably all the local health departments, right?
Yeah, so I think most local health departments link directly to the coronavirus.ohio.gov website just to make sure that they're sharing the most up-to-date and current information. but you can find it up there. It's our understanding from the governor's office that this map will be updated every Wednesday based on sort of the last week's worth of data. So this Wednesday, we anticipate the first sort of update to the map to see how we're doing and where we have hotspots, and what more specific work we can do within the communities to sort of get a better understanding of what's happening there.
Got it. Okay. So what are some of the ways that we all can help reduce the spread of COVID-19?
So first and foremost is, if you have any of the symptoms of coronavirus, if you've been exposed to someone who has been symptomatic or who has tested positive, stay home. Limit your exposure to your family, your community, your employers. That is the first thing we can do immediately. The second thing is, if you venture out into public, wear your mask. It's very important, and I know that it's a lot of discussion at the local levels and across the state and the country, but something as simple as a face covering truly makes a difference. So these are what we wear here at Franklin County Public Health. We want to make sure that we wear these to protect other people from getting sick. And when they wear their mask, they're helping protect us. So definitely important, wear a mask, be mindful, keep social distance. Those are tools that each one of us can do on our own to help prevent the spread of coronavirus.
Great. Okay. And it is something that right now it's required for employees to wear, face coverings at this point, unless they meet one of the criteria that they don't have to for a medical reason.
Exactly. So the Dine Safe Ohio order, as well as almost every other order that's been issued, has a face mask component to it, or a face covering. So restaurant employees are required to wear face coverings unless they meet one of the prescribed exemptions within that order.
Got it. Okay. And finally, so what are some suggestions on working with local health departments? If you're a restaurant owner, operator, a catering service facility, banquet facility, what are some suggestions on doing that?
So the first thing I would point out is, if you have an employee who tests positive, contact your local health department. But there are some things that you can do to help us sort of expedite the work on our end. That is keeping a log of who is working, when they're, on what shift, what are they doing, making sure your employees are wearing face coverings. All of those things go into our investigation and determine whether or not you have other employees who are what we would consider a close contact of that employee who is tested positive. So we need all of that information to be able to determine if you have a potential higher risk of exposure for your other employees. So keep a list, know when your employees are working, know what duties they are assigned. Make a note that if you have an employee who meets one of the exemptions for face coverings, that it's documented. All of that goes into what we do, and keeping that information and having it available when you contact us allows us sort of to expedite that process on our end.
Great. Well, is there any other information you'd like to share today? Or I think this was all so very helpful. And, our restaurants, we just want to keep everyone safe, healthy, and open here in Ohio.
Yeah, absolutely. I mean, the health departments want the same thing. We, want to be mindful of what we're doing and encourage social distancing and face coverings. And then we ask you just to make sure that you're doing the best you can to protect your staff and your patrons from possible exposure. So if you have questions, reach out to your local health departments, reach out to the Ohio Department of Health. They're still operating their coronavirus hotline, and make sure that you're in communication and you're receiving up-to-date and accurate information, which is equally important this day and age.
It is. Well, thanks so much for joining us, Garrett. And as always, Ohio Restaurant Association and our members, and really the Ohio restaurant industry, really appreciate your willingness to share information. So thank you.
Absolutely. Thanks a lot, Laura.